Good morning, everyone. Please come to order. We've got a quorum present. All the commissioners are here. All the notices have been duly posted, and the court is duly called. Is there a motion to open court? So moved.
Second.
All those in favor signify by saying aye.
Aye.
Aye. And available, please open court.
All rise. The Dallas County Commissioners Court is now in session for the month of October 2014 term, with Honorable Judge Jenkins presiding. Please remain standing for invocation.
And our invocation today will be given by a guest of Commissioner Daniel.
Thank you very much.
Oh, no, I'm sorry. Yeah, that's right, Commissioner Daniel. Sorry, long week, sorry. It is her guest.
I'll check myself. Good morning, and thank you very much. I would like to welcome Pastor Ed Middleton. And he is the pastor of the First Community Church in Dallas. He grew up in beautiful Smoky Mountains of North Carolina. He earned degrees from Gardner-Webb College and Southeastern Seminary in Wake Forest, North Carolina, and has continued his studies at various seminaries throughout his ministry. Pastor Middleton believes that devotion to his vocation comes from his commitment to God, who is always calling us to new places and opportunities of service. He is flexible in how he approaches ministry to a congregation, always trying to listen and to learn. Pastor Middleton came to the church in July 1997 with his wife Chris and daughter Anna Grace. His hobbies are fishing, reading, playing his dulcimer, and conversing with people through whom he often sees reflections of God. So thank you very much for Pastor Middleton to join us this morning in prayer.
Let us pray. O Holy One, whom we call by so many different names, these commissioners sitting in this place, we recognize meet often, conduct business, and go their separate ways. Sometimes they are like all of us. There is an ordinariness about it all, a routine. Yet we recognize that what happens here is never as routine or innocuous or ordinary as we try to fool ourselves into believing. People in this county will face changes because of decisions made on this ordinary day. Some may find those changes extraordinary, some perhaps even painful, though we may never know of it. We're thankful for committed citizens taking up the work of governance. We are thankful for those who will implement decisions made here today, some who faithfully labor in obscurity in order to feed their families and meet basic human needs. We're thankful that some of them still have benefits that have so easily and callously withheld by others doing business across the city and county. We come today asking by your very presence you might redeem this seemingly ordinary time. We pray that you would grant wisdom to those elected officials and place within each one an awareness of the burden they have assumed. Fill them with a gnawing hunger for a more just and equitable society. Fill their hearts with mercy and their spirits with humility as they conduct the people's business, which is, of course, always your business. We pray today that when this meeting ends, your ends will have been furthered by these agents. Hear this prayer, we do humbly ask. Amen.
Amen.
Amen. Amen. Thank you very much.
All right, and our resolutions today, our first is by Commissioner Cantrell.
Judge and Commissioners, this would be for Rebecca Norris, who is at the Constable's office in Garland. She has served for 38 years and 2 months, and this will be presented she'll be retiring, and this will be presented at a later event. So I move its approval.
Second.
All those in favor, signify by saying aye.
Aye.
Aye. Motion carries unanimously. And our next three are by Commissioner Price.
Judge and Commissioners, we are pleased to have with us Alice Paul and her delegation today. So will they come forward? Did she make it? Oh, there she is. Okay, and the delegation? She doesn't go anywhere alone. So whereas Alice Ann Paul came to work for Dallas County Domestic Relations Office starting on February the 12th, 2007, as a senior secretary for the Family Court Services and quickly became the heart and the soul of the department. And whereas Alice graduated with honors from Athens High School, attained an associate applied degree in business administration from Trinity Valley Community College in Athens, Texas, and whereas Alice's husband of 40 years was always being promoted to different locations by his company of 43 years, two facts that Alice is very proud to share. Alice, too, enjoyed her work in each of the locations where they resided together, including Waco, where she was working in the McLennan County Health Department, and at the time, she interviewed for her position with Dallas County. And whereas George and Alice are the proud parents of Michael, Calandra, Nakisha, and the grandparents of Gary and Devin, and the great-grandparents of Lyric, Nicole, and Alice's family means the world to her. And whereas no casino can hold Alice back from winning, with her savings from her lucky coin jar and her no scratch-off lottery ticket passes through Alice's hands without giving her some green, for which her co-workers are eternally grateful, as it usually means they're going to get kolaches for breakfast the next day. And whereas Alice Ann Paul, who most accurately identified herself on her resume as a loyal, hard-working self-starter, is officially retiring on October the 31st, 2014, having served the families and the children of Dallas County for 7.5 years with all her heart. Now therefore, be it resolved that the Dallas County Commissioners Court does hereby commend Alice Ann Paul for her years of service to the citizens of Dallas County and wishes her good health and happiness in her retirement, and I so move.
Second.
All those in favor signify by saying aye.
Aye.
Aye. Motion carries unanimously. Alice?
Miss-
I give respect to County Judge Jenkins, respect to my commissioner, John Wally Price, and to all of the other commissioners that sit on the board. I thank you for allowing me the opportunity to serve Dallas County in the Family Court Services Division. I've learned a lot, I've grown a lot, and I hope I've given a lot. But again, I thank you, I thank you, I thank you.
Well, you got some people with you, at least one that you may not be able to go home with. That you want to introduce?
This is my husband, George Paul.
Okay.
And trust me, he is going home with me.
Oh, okay. I didn't really want you to go home.
And then do I need to introduce
Well, just at least tell us who's kind of with you there, just kind of the gang, where they from.
Director, Angela Igerson. This is my manager, Denise Frank. And the others are counselors, Kathy Collins, Crystal, Jennifer, Linda, Jennifer, Diane, and then Delia, Alfredo, Cindy, Clelia, Justin, Caroline,
The rest of the pineapple wines out there.
and Dennis.
Okay.
Okay?
Thank you, and I'm sure that they want you to leave that lucky coin jar in that green hand here.
Can't do that.
To do that. Thank you for your service. Next resolution, Judge, there should be a delegation here from the NITBA
Alex Smith is here, I saw.
and Value Options or part of BHLT, all that delegation will come forward. This resolution is extremely important, as are all of them. But this resolution is sponsored by co-chair Dr. Teresa Daniels on the Behavioral Health Leadership Team, and all of these people are part of that team. Whereas on October 2014, the Texas Sunset Commission staff, the report on Texas Health and Human Services Commission recommended that Texas discontinue the North Star mental health system model. And whereas the North Texas Behavioral Health Authority Board, the Dallas affiliate of the National Alliance on Mental Illness, the Mental Health America of Greater Dallas are supportive of the North Star system and its continuous efforts to enhance the model through the integration of primary care, specialty care, and behavioral health services for consumers, and it desires to refine its ability to draw additional state and federal funding. And whereas North Star is an effective, strength-based, recovery-oriented, integrated mental health and substance use disorder treatment and services delivery system that has operated successfully in North Texas for 15 years. It was designed with input from consumers and providers of behavioral health services in the 7-county area of Collin, Dallas, Ellis, Hunt, Kaufman, Navarro, and Rockwall counties. And whereas since 1999, North Star is the only mental health or substance abuse region in Texas that by design does not have a waiting list for services. Previously, the 7-county region served about 10,000 individuals, and now over 73,000 individuals receive services. And whereas North Star divides the managing authority function from the provider function, a feature that has been acknowledged as good public policy and one that is supported by mental health advocates, it is a public-private partnership where there is a healthy competition among an extensive network of over 300 providers, resulting in better choices for consumer and a lower cost for the state, with treatment outcomes among the highest in the state. And whereas the annual cost of providing mental health care in North Star in 2014 was approximately $1,587 per person, less than half of the annual cost of $3,684 per person in the rest of the state. And whereas North Star serves people who are indigent or on the Medicaid throughout a no wrong door, open access, integrated provider system on a single management platform that supports coordination, planning, and a continuation of benefits without interruption if an individual has a change in Medicaid benefit status. And whereas North Star has led the state in the employment of peer-to-peer specialists in psychiatric hospitals, hospital-to-hospital transportation services, residential substance use disorder treatment, and community-based clinics, and in the number of members receiving accelerated community treatment services, or what we know as ACT. And whereas North Star has facilitated the behavioral health response in community disasters, especially in Hurricanes Katrina, Rita, Gustav, and Ike, and currently working with the state and local authorities regarding the Ebola crisis to ensure that the needs of people with mental illness and substance use disorders are met regardless of the challenges. And whereas North Star has been a consistent innovator in jail diversion, pre-release planning, outpatient competency restoration, and crisis stabilization, allowing the police, fire, and other first responders to spend less time waiting in emergency room and more time in services in Medicaid recipients, the New Life Opportunities / Prostitution Diversion Initiative, and other new ideas which have led to public policy changes statewide. Whereas Dallas County supports local choice and design. Now therefore be it resolved that the Dallas County Commissioners Court does hereby recognize and support North Star as a successful and productive system of delivery of mental health and substance use disorder care in Dallas County, and conveys to the Sunset Commission and the legislature the message that North Star works, that it is an effective, efficient, and economical system of care for the county and the region, and be it further resolved that the Dallas County Commissioners Court asks the Dallas County Legislative Delegation and the legislature to reject the Sunset staff recommendation to discontinue North Star and instead fully support the evolution of North Star with the evidence-based data that allows for the local control and design built on inherent strengths of the current system. And as I said, I, along with my co-chair, move and second.
I second.
All right. And all those in favor signify by saying aye. 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 Any opposed? Hearing none, motion carries unanimously.
Stretcher.
First, let me express extreme appreciation to both Commissioner Price and Commissioner Dr. Daniel. Their leadership on the BHLT has been instrumental in this. Also want to thank Dr. Garcia, Ryan Brown, and Dr. Richard Scotch, who also serve on the NITBA board. They've been very active in this process. I think I am more proud of us as a system today than I have ever been. We've spent the last few weeks having to take a real hard look at ourselves. Where are we headed? What do we need to do? How do we come together to move forward? Obviously, if you've had a chance to even look at the title of the Health and Human Services Commission Sunset Report, we've made somebody down there in Austin really mad because it was a really negative report and almost personal in its tone and attack. But it has caused us to look at, we're going to have to make some changes. A big thing that people say, things change, and they have. But we've come together to highlight what is the strength of our system. And I really think you can get past the numbers and the programs. The strength of our system is sitting here in this building today and is in front of you. We have leadership at the highest levels within the county that support and are on board with doing the right thing. And then you've got here today advocates, providers, rich group of individuals working together, and I don't think this happens anywhere in the state. Today's the easy work. It's easy to come together and kind of agree on big principles. Now we've kind of got to look at what changes do we make to maximize our use of dollars, and I'm confident we're going to get there. You'll hear much more about this. It's a critical issue. We also want to express our appreciation to Charles Reed. Charles has gotten in there to really learn our system and what we're about and what we need, so he'll be able to support our efforts as this moves forward.
I also want to thank Jermaine White from Dr. Daniel Stafford, which has been an integral part of the BHLT. You talk about it being easy to come together. 6 years ago, we didn't think that. In fact, we couldn't all get in the same room, much less, as I usually say at the committee, in the same boat. We knew the boat was sinking, but we just wouldn't all get in there. And so we've climbed in, and I think that there were some prognosticators that were basically saying we couldn't stay. And 6 years later, we're still all in that boat. In fact, probably more bound together than ever. We're the only group in the state that has a third-party administrator, Value Options. They're definitely in there with us. And it's been a real interesting challenge But I got to join Mr. Stretcher in saying, when you read that Sunset Commission report, and you know, we usually hear this every legislative session, it's like, you guys keep it up there in the Southern County region, and we'll make the rest of the state work. The real number is that we get about 16% of the funding, and we service about 30% of the population. And we continue, as they would say in Egypt, to make brick out of straw. I just want to say thank you to the group. Like you said, the work really now begins for us to get the legislature to make them understand. But I still want to applaud all of you who are here, who continue to day by day make it all work. And that's been the glue for us working together. So.
This resolution is an incredibly strong statement of what's going on here in North Texas with the county's commitment, plus also the incredible support from every one of those people standing right there of what's going on in North Texas and our dedication to the people of North Texas. But it's looking at this group of people here that makes it all possible. And it is such an impressive group with hundreds of years of experience of providing service and recognizing what it's going to take to make a better place here. If you may indulge, I would like to have these people recognize and introduce themselves, just to demonstrate the width and the breadth of the support and just the years of experience that go into what we're doing today and what we're doing tomorrow. And as we're famous for saying, we are not done yet here. So do not think that you're going to count North Texas out of this. So if you
But let me also add something that is very important, Commissioner, and I think Commissioner Price and Mr. Stretcher made a point strongly about it, is the fact that it has given us the opportunity to change some of the things that in some others' perspectives, obviously is a challenge that we have here. And for us, continues to be the most important thing, the funding. Like Commissioner Price mentioned, we do a very good job, but with very little money. And that has to be a point that also has to be addressed. We cannot continue to have, a 16% to take care of 30% of the population in North Texas. So, I think that this is a good first step. I'm glad that we are together with a unanimous voice, but we have the opportunity to address some of the things that they believe we're not doing. So, with that being said, thank you all for being here. Continue to do the work that, you all do so well here with the North Texas community. So,
Janie, you want to take everybody and start and introduce yourself and pull that mic down.
she's been working night and day.
Janie
Thank you,
Metzinger, Public Policy Director with Mental Health America of Greater Dallas.
Alex.
Alex Smith, the Executive Director of the North Texas Behavioral Authority, and I would like to say we echo everything that Ron Stretcher has said before you and the applause that has come from the County Judge and the Commissioner's Court. We would also like to let you know that our board members representing the other 6 counties will be bringing similar resolutions to their counties in support of all of this. And let's hopefully all working together. North Star is a good deed, so let's make sure it goes unpunished.
Sandy?
Sandy Potter, CEO of Value Options North Star Program, social worker in the community for 30 years.
Sheila Adams, Chief Executive Officer at Timberlawn Mental Health System.
Commissioners, Matt Roberts, President, Mental Health America of Greater Dallas.
Good morning. Tom Collins, CEO, Green Oaks Hospital.
Scott Black, CEO for Transcare.
Marsha Rogers, Director, NAMI Dallas.
Liam Mulvaney, CEO, LifeNet.
Lana Presley, Secretary of NAMI and retired Dallas Sheriff's Department.
Mental health specialist.
I don't know if I'm mental health. I may be mentally. I don't know.
I'm very active in the Prostitution Diversion Initiative.
John Dornheim, Green Oaks Hospital, NAMI Dallas.
Leonard Kazee, Green Oaks Hospital, and NAMI Dallas.
Constance Willis, I'm a person in long-term recovery. APA, the Association of Persons Affected by Addiction, I am the Community Relations Manager.
Annie Smith, a person in long-term recovery, Associate Director of APA.
My name is Joe Powell, and I'm a person in long-term recovery. What that means is that I haven't had a drink of alcohol in 25 years, and it's only because of long-term recovery I'm able to be the executive director for APA, the Association of Persons Affected by Addiction, providing an innovative model for North Star for peer services, peer-to-peer, providing recovery support services. Thank you.
That's great. Thank you. And then last one, Dr. Garcia reminded me that I've used up all of my resolutions for the month, but
There was some of the month left.
yeah, right. Thank you. This last one is a resolution of EMTALA, and let me just kind of frame this as I saw a lot of partners in the whole behavioral piece. They also happen to be on the primary care side of the aisle with some of our fellow hospitals in this community. I'll remind the court as well as our citizenry, at least for the last 3 decades, I don't recall when we have not balanced the budget with regards to Parkland Hospital to the tune of about $33 million this year. As you know, there are basically 5 hospitals in the state of Texas that puts up what we call the IGT money. That's that intergovernmental transfer money. Last year, I think Parkland put up about $120 million. This year, they're on course to at least spend that much and more. And so I think we owe it to our citizens, which contributes about $400 million to Parkland's budget, bottom line, to say to all of those hospitals in this area who are the beneficiary of the IGT money, that intergovernmental transfer money that our citizens put up, where dollars, the state leverages those dollars and they come back to the community. When I look at Parkland's deficit this year, I also look at some of those other hospitals' profit margins. And so it's incumbent that our citizens know exactly how we're in the same kind of collaborative that we just talked about with regards to mental health. And so this resolution, basically Parkland being a member of the Regional Hospital Council, this resolution is to ask that the study be performed. So whereas in 1986, Congress approved the Emergency Medical Treatment and Active Labor Act, better known as EMTALA. And I do want the record to be real clear. It was fostered by the late Dr. Ron Anderson, which seeks to ensure patient access and prevent the practice of patient dumping. That is, the transferring of uninsured patients from private to public hospitals without consideration of their medical condition or stability solely for financial reasons. And whereas EMTALA requires hospitals that participate in the Medicare program to perform a medical screening examination on any person that comes to the hospital and requests care to determine where an emergency medical condition exists, to stabilize that person with the emergency medication condition or transfer them to another hospital with more appropriate capabilities, and to accept the transfer of patients in need of specialized facilities and capabilities if they have the capacity to do so. And whereas the law also prohibits any participating hospital from delaying the required screening, examination, or the provision of care in order to inquire about a person's method of payment or status of insurance. And whereas Parkland Health and Hospital System is one of the nation's busiest public hospitals, and Dallas County is one of only 6 counties in Texas that provides an intergovernmental transfer for the funding of state indigent health care, and whereas almost 30 years of existence, it is very important to assess the effectiveness of EMTALA in the Dallas area. Now therefore be it resolved that the Dallas County Commissioners Court recommends that the Dallas-Fort Worth Hospital Council work with Parkland Health and Hospital System and other appropriate organizations to commission an independent study to determine the effectiveness of the Emergency Medical Transportation and Active Labor Act in Dallas County. And I so move.
Second.
And
I've got a question before we vote. Could Angela, could you come forward, or somebody from Parkland? Are y'all requesting this? Is this something?
No.
Generated from Parkland?
No, it's not. No, and I don't know, Ms. Morris may be here, but no, this is not, no, this is, I am requesting this, Judge. No, this is not Parkland. I'm asking Parkland as a member of the Regional Hospital Council to do that. I just said, we didn't balance our budget this year, and other people are the beneficiaries of this. And so all I'm saying is we need a study. We owe that to our taxpayers, you know, as to people who are benefiting from us putting up dollars, but, you know, how they participate. If you look at some of the area hospitals' bottom line, they're doing well. They didn't have a budget deficit. They did not have a deficit. We did. We didn't balance the budget. And so, no, they didn't ask, they didn't request it. And they may not want to do it, but it won't be because they weren't, that I didn't request it, somebody asked if they do it.
Well, and it wasn't in my book, and it's no reflection on anyone, but I haven't seen it, and I'll be active in an after action that deals with some of those issues. So I'm going to just abstain. I'm not opposed to your motion, but I'm going to abstain from voting on anything on that at this time. But
well, I've got a couple of questions. First of all, with regards to the enforcement of EMTALA, that's done on a day-by-day basis. In other words, if there's an allegation that patients are being dumped, who does that enforcement? Isn't it CMS? CMS.
Yes, sir.
So, you know, I'm assuming, do you have knowledge of specific instances where individuals are being, quote, dumped, or?
I think the report will bring that forward without me making specific allegations. I can make an allegation, but I don't have.
Okay. Well, I didn't know if you know of specific instances where this is taking place across a broad spectrum within the Dallas-Fort Worth area, or?
Well, I think the fact that you posed the question, Commissioner, basically says that, and when I talk to my point, we don't have that information. We don't have, unless you guys, have that information, we don't have it. And I think if anyone would have it, it would be the Regional Hospital Council. I just think we owe it to our citizens to find out what our partnership arrangements are in this whole indigent health care model. And EMTALA is kind of the bedrock, if you will, for indigent care versus, quote, charity care. And when I begin to really, dig down, one of the things I want to talk about the rate of admissions of the emergency department patients without insurance and without Medicaid. I want to talk about the follow-up visit. The same thing the CMS kind of hit us up as I continue to look at that report. The care for ED, primary care, specialty care, chronic diseases. That's part of that whole indigency piece.
Right.
And so that's what,
But under EMTALA, that specifically addresses stabilization of individuals that come into the hospital. It doesn't mean ongoing treatment or surgery. Is that correct?
well, that is true.
Okay.
That is true. No,
Okay, and we do have a public hospital that utilizes tax dollars in Dallas County. So,
But we also, that same public hospital takes,
no, I totally understand that, and that's the state that develops that formula.
but it's not like we have a real choice in the matter.
We have a choice. We may not like the choice.
Well,
But we do have a choice.
but we have some other people who are beneficiaries of it, and that's where I was going.
So I guess my question is this. If the hospital council has knowledge of patient dumping, then it looks like that would have already been forwarded to CMS. In other words, it seems like CMS would be the one that has more knowledge about patient dumping than anyone. I guess what you're saying is let the hospital council go in and audit the books of every private hospital? Is that what we're looking at?
I'm saying that I'm sure all of these hospitals are a member of the Regional Hospital Council. And I'm asking them to commission a study, along with Parker, to ascertain that information.
Okay, so that study would necessitate an outside consultant coming in and to reviewing the books of every hospital.
However, I don't know the rules of the Regional Hospital Council. All I know is that Parkland is a member, the taxpayer dollars, and somebody should be at least querying and asking the question. The fact that you and I are in conversing, because, I don't know if they'd give it to you or to me, but they're a member of the hospital council. And we need to be asking the question. They're a member there, so what do they get other than, the camaraderie of being part of the council? And I'm not minimizing their membership. I'm just saying we need to be asking those kind of questions.
Well, I guess my concern is if you're making that inquiry specifically based on where Parkland's budget was this fiscal year versus what their bottom line is, then I would probably have a problem with that.
Well, not necessarily that, but I'm just saying we have a right to ask it, as much as we didn't balance our budget and we put up the IGT money.
Right. Well, but when you look at what these other private hospitals contribute with regards to charity care.
Now, don't mix charity and indigent. There is a difference.
Well,
charity is.
No, I understand.
Okay.
But if that charity care wasn't done, where would those patients end up being?
But a lot of the charity though is write-offs.
Okay.
Okay.
Regardless of what it is, people need the care. They're going to go somewhere. And so if those private pay hospitals weren't out there and making a profit to where they could do the charity care, where would those individuals end up being?
But do you know what that relation, do you know what that number is?
Well, let's evaluate it.
Yeah.
Let's just bring the numbers forward and see where they...
And I'm going to support the resolution because I believe as one of the 6 counties, that do this IGT transfer, Commissioner Price brings up a good point. We need to know some of those numbers. I think all the hospitals that we have here in the North Texas region, most of them do the best they can. They're fantastic facilities. We have just seen the interaction and the great work they have among each other. However, I would like to see some of those numbers. I think Commissioner Price is right on saying that we need to see that difference, indigent versus charity, what is a write-off, what is not, and the formulas. I was shocked to find out that different hospitals have different formulas. I would like to know the real numbers. I think we owe it to, Dallas County citizens, and hey, like Commissioner Cantrell said, we might not like the number, and it's set by state, but at least we have an idea of how we work within the system, and of course, with the only indigent hospital that we have in the North Texas region, that is Parkland.
Well, I was speaking, Dr. Garcia, specifically to how the state government deals with pulling down federal dollars.
Yeah.
Yeah.
Yeah, no,
And the relationship among the various hospitals.
Okay. I think it would be better if internally the hospital council and the hospitals decided to do it on their own and not prompting from
And to have to work together.
the public health, the only public health hospital in Dallas County. So, but anyway, that's
Let's see where the
difference of
numbers-
philosophy, so.
Let's see where the numbers take us.
And it might
And
take
this is a request.
working together. I mean, the resolution doesn't say that it cannot be a joint effort.
Right? And I'll just say that I think EMTALA is probably the most important law to protect the rights of indigent people, that the DFW area has the most highest number of uninsured. Texas has the highest number of uninsured. I do not oppose the philosophy or the spirit of this. I'm abstaining for other reasons. Any other discussion before we take a vote? All those in favor, signify by saying aye.
Aye.
Any opposed? Nay. And I will abstain. The ayes have it.
Sure that everybody gets the resolutions.
All right, and we have another resolution from Dr. Elba Garcia.
Thank you, Judge, colleagues. I'm very honored today. I'm very excited about this resolution because it really talks about the legendary locals of Oak Cliff. And I'm going to ask the group that is here representing Alan Elliott, Patricia K. Somi, and Gayla Brooks, that I know they're here, to come forward to the podium. For all of you that have probably not seen this book, it has, a small, a description of a lot of the people in Oak Cliff that have made a difference, not only in Dallas, but in Dallas County. And among some of the people that are there is obviously my colleague, Commissioner John Wally Price, my good friend of many, many years, the Honorable Chris Simons, as well as Sheriff Lupe Valdez. I don't know if the sheriff is here, former county judge Lee Jackson, Senator Royce West, former Dallas County Treasurer Bill Melton, among others, also City of Dallas council members like my good friend Delia Hassel. Hey, what can I say? My husband is with me in the picture, so I guess I have to name him. And yours truly, after 30 years. But nevertheless, I believe that when you know the history, we know where we're going. And obviously, what can I say? I've been in Cliffite for more than 30 years, so I'm delighted to read these resolutions that says, in 2008, Alan C. Elliott, owner of the oakcliff.org, was contacted by Arcadia Publishing, a company specializing in niche histories, seeking an author to compile a history of Oak Cliff. Accepting the project, Mr. Elliott invited writer friends Patricia K. Somian and Gayla Brooks to join the project. And whereas released in 2009, the book Images of America, Oak Cliff, a pictorial history of the west and south side of the Trinity River, proved to be so popular. In 2012, Arcadia Publishing approached again to write a follow-up book, Legendary Locals of Oak Cliff. And whereas, while the first book heavily featured buildings, businesses, and other Oak Cliff locations, Legendary Locals of Oak Cliff focuses on Cliffites, I love that, who have impacted not only Oak Cliff and Dallas, but also Texas and the world. And whereas the authors research and gather information about the rich history of Oak Cliff from the time it was a separate city to its annexation to Dallas in 1903, to the present, where it now constitutes almost a third of Dallas landmass. And whereas all three authors have deep Oak Cliff roots, Alan Elliott and Gayla Brooks grew up in Oak Cliff and attended local public schools. Patricia Somi married into an Oak Cliff family, lived in Oak Cliff and taught in Oak Cliff for 31 years. She and her late husband, William Bill Somi, were charter members of Kidd Springs Neighborhood Association. Whereas through their combined efforts and the individual efforts of Alan C. Elliott via his website and Gayla Brooks via backstory, column in the Oak Cliff Advocate magazines, the authors endeavor to keep the history of Oak Cliff vibrant and help readers understand the significant leadership contributions that have come from and continue to come from this vital section of Dallas. Now, therefore, be resolved that the Dallas County Commissioners Court celebrates Oak Cliff as a vibrant part of the DFW area, and DFW area recognizes the important work legendary locals of Oak Cliff, as it captures the heart of the people and the history of Oak Cliff, while also serving as a great example in the recording of local history of all sections of Dallas County. And I so move.
Second.
All those in favor signify by saying aye.
Aye.
Aye. Motion carries unanimously.
Mr. Elliott, or
In author order, I suppose. I really appreciate it. The County of Dallas was a great place to grow up. I grew up in Oak Cliff on Kellogg, and then later on 5th Street. Graduated from Adamson High School, so I had a lot of, just a couple of houses down from your house, Commissioner Price, and so we grew up there. We enjoyed living in Oak Cliff. Oak Cliff, just like the County of Dallas, has a lot of people exhibited by the kind of people that were here today that are very interested in making Dallas and Oak Cliff and the entire community a better community to live and to serve. We really thank the Commissioners Court here for this resolution and the opportunity to share some of our books with you. So we brought books for you.
Thank you.
I was just going to say thank you especially to Dr. Garcia for inviting us to participate in this today. One of the things that we also wanted to present, we have copies of both books for you. So if you're not familiar with a lot of the things in Oak Cliff that are great memories for us, we just want to share this with you too. Also, we have a copy of a pictorial celebration of Tyler Street United Methodist Church. Tyler Street is a historic church in Oak Cliff at 10th and Polk, and just celebrated the 100th birthday in 2012. So we have copies of these for you. Gayla?
That's Fred Durham's old church. Right? Yeah, it's a good church.
And Mrs. Brooks?
Y'all got the 1946 Sunset Bisons in that book?
Of course they are.
Oh, I've got a picture of my daddy in there somewhere, man.
Thank you very much for
so much.
He was a lot less political.
He was a lot less political, and a better runner.
Yeah.
Judge Jenkins, I went to school 1st through 12th grade with Fred, so we've known each other a long time.
Great man.
Yes. As a sixth-generation Texan and native Dallas, I thank all of you, especially Dr. Garcia. Thank you. This is a lovely honor. I appreciate it very much.
One addendum. I work out at the Folsom Gym at Methodist Hospital where I volunteer. And one of the men there is Larry Beecham. And Larry is one of the ones who helped us gather information. He tromped through the old Oak Cliff cemeteries with me. And he wanted to be sure and say good morning to Judge Jenkins because Judge Jenkins was in his 7th grade Texas history class.
We'll tell him hello. I remember Mr. Beecham, and I only got sent to the office twice in that class.
Mr. Beecham was a little short.
Thank you very much for sharing your clip with us.
Thank you so much for the visit.
And Coach Finley had a mean swing with that board. I remember that. That was great.
He didn't aim high.
They don't beat kids anymore. They did very good.
He didn't aim high.
All right, so is that our last resolution? All right, we'll tell you what the consent agenda. Is there a motion on the consent?
You guys separate out the personnel actions. I did say that, just like I took the resolution.
Oh, this is here.
I did say separate out the personnel actions. If you pull the personnel actions out.
Then we'll approve for the consent agenda.
Second.
All right. So this is
Personnel.
107 excluding 6.
Excluding, personal actions. Yeah.
Ms. Porter, any payments?
No.
All right, so there's a motion and a second on 1 through 6, or on the consent agenda excluding 6. All those in favor? Aye. Aye. Motion carries unanimously. All right, anybody want to move 6?
I'll move 6 with the exception of 21, 22, 1.
Yeah, let me look on your cheat sheet. All right, so we've moved move 6, with the exception of one number, 21, 22, 1.
It would probably be easier if we moved all of them and you voted against
That's
those two, wouldn't it?
Okay,
I'll move item number 6, personnel actions.
Somebody second.
Second.
Any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Any opposed?
Let the record reflect that I did not, I'm voting against employee number 21, 22, 1.
All right. Motion carries. We have a bid. Actually, I think we have 2 bids. Is there a motion on the bids? That one?
So moved.
That was included.
Second.
Oh, that was awards.
No.
Awards, okay.
And I
There's 2
second.
bids. Okay.
Yeah.
Did anybody move the, well, he and I were talking, did y'all 2 move it?
I moved, there should be just one's an open, the other one is just one award of bids. There's only one award.
Right.
Okay.
Anyone moved it? You moved it.
I second.
All right, and it's been seconded by Commissioner Garcia.
Make a motion, Commissioner.
I did, oh, I'm sorry.
Done.
All those in favor signify by saying aye.
Aye.
Aye. Any opposed? Motion carries unanimously. Next, we have court orders J1 through 18. Is there a motion on court orders J1 through 18?
I'll second.
All right, it's been moved and seconded. Any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Any opposed? Motion carries unanimously. Next, we have the time-sensitive court orders K1 through 6.
I move approval.
We have a motion and a second on that.
And I just want to mention, Judge, that on number 1, I want to congratulate the District Attorney's Office for the bilingual felony family violence sexual assault case worker. You know, it was already in the works, and, you know, this just makes it final. Thank you so much.
I wanted to make that note also, that in those times when you really need sensitivity in traumatic situations, having a bilingual counselor there is incredibly
This is
needed.
1 to 6.
All right, all those in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. And now we have items for our briefing session, which will...
Yeah, so you got, well, you know, just like the EMTALA resolution, I specifically put on there briefing on the Ebola piece, and I didn't see it on my deal.
Yeah, it's only that.
It's not on the
It didn't make it.
It didn't make it, just like you were saying, you didn't get the EMTALA, I'm just saying, it didn't make it on mine either, but okay.
Only.
But it's fine.
Are you saying it's...
No, it's there. It's I got it on, I'm just saying.
Is it properly posted? Is there a question posed? Okay.
No, I just want to make sure that when you said a few minutes ago, I put it all down at the same time.
So Mr. Thompson?
It's addendum number 11.
Our agenda now calls for a briefing session which consists of items to be considered for a subsequent session. I found that all the things on there were properly posted. If you'd like to start with the Ebola situation report, find me.
It's a short briefing. It's real short.
Zach?
Yeah, Judge, Commissioners, again, I want to thank our top dog, Dr. Perkins, Thomas Scroggins, Erica Narrows, who has been involved in our day-to-day activities. I want to make sure it's real clear as we look at heroes, make sure that all of our staff are included as heroes and not one single person. These folks have been working day in and day out, and I want to thank our lab personnel, and I'll focus on that here in just a second. But there is no one single hero at Dallas County or Dallas County Health and Human Services. Let's go to the next timeline. I want to reiterate because there's a lot of misinformation out there, and so I'm going to recap, and this will be our last update in terms of the Ebola updates before the court unless something changes. But basically, Dr. Perkins and I were notified on September 29th. You see that immediately I notified the court that day when I found out. We did a presentation the next day. Let's go to the next slide, Ryan. On that, since our efforts, we've been involved in, and I want to thank our lab staff who on this past weekend We had mentioned to the court that we had the capacity to do Ebola testing in our lab. I contacted the CDC. They sent someone down to review our lab, and immediately we were approved based on our level 3 capacity to do Ebola testing, which could have been done day one. So in that, we were requested to do.
Let me interrupt you for saying here, this is a big deal. There are 12 states in the country that can do a PCR Ebola test out of 50. There is one county out of 3,560 something. 61 that can do an Ebola test, and we're sitting in it. So good job on the part of Dallas County Health and Human
That's why I say everybody is a hero in this, because our lab staff came in on Sunday and ran 2 tests that they were negative, but the capacity now not to drive 400 miles to drop off a specimen and risk their an accident.
At a cost of about $500.
$500.
The way you do it. Increase the efficiency.
It's not just that. These ladies, these people, you know, they get sick, their stomachs get upset, they, you know, I mean, they're nervous about this. And they come in, they want to get that test done, and that's 3 more hours, 3.5, 4 more hours. They have to sit there wondering if what they've got is Ebola. So it's a lot more humane thing for us to be able to do it as fast as possible.
Again, we had to ask for something that we already knew we could do. The other aspect I want to mention, they were talking about the 13 languages. I'll send something to the court that I believe the state of Minnesota, or one of the states, has requested our 13 languages as an example of what they can utilize, since the CDC does not have the multiple languages. So I find it odd that people say you're late, but guess what? Nobody else had it. So now other people want what we have. Our EPI staff has been involved. We want to commend. I always remind people our EPI staff work for Dr. Perkins, who's the health director, medical director for Dallas County. We're still partnering. I want to make sure we mention, I want to thank Dr. John Paulo and the Dallas County Medical Society for assisting us in answering a lot of questions that we're getting for constituents. That's definitely been a great help in terms of doing that. Let's go to our next slide. Uncharted territory. There's a couple of things that we need to look at, and we'll follow up with Tony. And there was another email that came in last night, but let me start with what we were needing to look at. In terms of voting, the question on the table that we have to ask ourselves, if a person is under a quarantine or control order, these are questions that we need to look at going forward. If you have to institute a quarantine or a control order, would these individuals be allowed to go, or how would they be allowed to vote if voting was going on? So that's the number one question for this being on today. And so that's something we're going to have to look at. When you issue a quarantine or a control order, how would those individuals be able to vote if there was an election time? Second piece in this is that we look at, and I just mentioned your name, John Carlos, so thank you again for responding to some things. The other aspect in this is what we got from an email we just got about the workers who are in the voter booths being able to have proper information about prevention of Ebola, and we're going to get that information to them. The next 2 points are legislative issues that we need to focus on, and I sent that to Darrell to consider on and it's really in the third bullet where we talk about Health and Safety Code 81046, is that we found that our police chiefs, they needed certain contact information. I don't know where they were getting the legal advice that they couldn't, but that's fine. I'm glad we were able to get the names out there to them. But the bottom line is we need to review this health and safety code to address that, so if we have a similar problem. And also ISDs need to have those contact names as well. So we want to look at that on the Dallas County legislative agenda to review that and have a healthy discussion about how we're going to go forward in the future when we have emergent diseases that require control orders, require quarantine, how we're going to deal with that with our law enforcement. Our first responders are a priority. They should have the proper information, and at no time should a first responder be told that they cannot go to a house and then somebody asks them to go do a safety check. That is contradictory to what we're focused on. Also, we've asked Dr. Perkins to meet with the hospitals, contact dishes, and I assume that meeting was already set, because once I sent my email, they told me a meeting was already being held, so you know how that goes around here.
You're going to be leading it after this.
So I guess we're going to lead it.
But you're going to, it's like everything else, you're going to have to lead it from the rear.
Right. Last thing I want to mention before we bring Dr. Perkins up is that I will be making a request again, based on what we're seeing in terms of our staff and the time being spent. We do need additional EPIs on staff to support these type of outbreaks. I've asked the CDC again to provide CDC staff to help with the tracing and monitoring to take the load off our current staff who have been going day and night. So but I still think we need to have something in our budget or submit something to CDC to request additional funding. And so I'll move forward with that. I'll work with the budget office in terms of crafting that information. And again, finally, I just want to again reiterate in terms of where we're going. Dr. Perkins has done a great job. As I mentioned, Tamara has done all the responses that we get from the EOC. Tamara Scroggins, our Assistant Director of Public Health, has been responding and coordinating that. I want to thank her because I find it amazing that everybody gets, thank yous, but I'm going to say it because it may be the last time I'll say it. But here's the concept. When they asked for Louise to be examined when she was first moved, before she was moved out of the apartment, it was Dr. Perkins who done the assessment. That picture that they show in terms of the New York Times, of us coming out, that was because there was a request to go and do a medical assessment of Louise. No one else did that. Dr. Perkins did it. Also, on daily visits, Tamara went out every day. We didn't send a staff. She went out every day to check on Louise and the family to see what they needed and reported back and did her own observation as a nurse on Louise. So when we start talking about heroes, we got to make sure we're including everybody at Dallas County Health and Human Services and not one person. And then finally, Dr. Perkins did a follow-up visit to check on Louise at the location, at the private location that she was at, to make sure not only Louise was okay, but everyone living in the house. That gets left out of the whole message about what Dallas County Health and Human Services is doing. Erica, in terms of the publication, of getting the language information out, of getting information out to everyone in terms of our Ebola information, that's been done by our PIO. So again, I would think it would be disheartening if I see just one person, as it was done before, talked about and not mentioning it. If you're going to mention one staff from Dallas County here, mention all 100 of them, and I'll be satisfied. I'm bring up the top doc, the only top doc we got in Dallas County.
Thank you, Director Thompson. Good morning, Commissioners Court, citizens of Dallas County. This particular slide that's posted is giving us a snapshot of the Ebola tracing, contact tracing here in Dallas County, and this is as of 5 o'clock on yesterday evening. As far as confirmed cases here in Dallas County, we've had 3 of the contact tracing results to the actual 3 cases. This is a fluid, dynamic process as far as the list, where some are coming off the list, others are going on the list based on our contact tracing. So as far as possible contacts and contacts are identified as recognized exposure to an Ebola patient, blood, bodily fluids, specimen of Ebola patient, or potentially contaminated surfaces. That total is 12. We have 3 that are current on the surveillance list, and 9 have completed surveillance. Of the possible contacts, defined as people who have had possible exposure to an Ebola patient or the bodily fluids of the Ebola patient, that currently stands at 114. Of the total 156 possible contacts, 42 have completed surveillance. Next slide, please. That previous slide was looking at the contact tracing as relates to Dallas County and the North Texas area. Now, this particular slide is talking about the latest numbers as it affects or impacts Dallas County residents. So again, the total number of cases in Dallas County has been 3. Unfortunately, we have experienced 1 death. That was the index case, Mr. Duncan. Laboratory confirmed cases matches the total cases, which are 3. As far as the Dallas County community, definite exposure, 31 of those have completed active surveillance. Possible exposure, 67. 8 have completed active surveillance. That gives us a total of 104, with 39 of those completing active surveillance. To date, as far as what we have tracked, Dallas County citizens' contacts has showed no symptoms.
Finally, we won't have any comments about we're getting a lot of requests about what happened in terms of travel and who authorized it. As far as I'm going to be very frank, Dr. Perkins and I was not consulted on any travel for anyone to leave Dallas County, and so when we get messages like that, we're not going to address those questions. So I just want to make sure it's clear on certain things we're not responding to. We were not consulted, and so therefore I want to be clear to the court and transparent that we don't respond to questions that we were not involved in.
So where
We
are you,
use our name a lot, Dallas County Health and Human Services, but
where are you referring those questions to? They need to go to some
I'm going to refer them
contact.
on to the EOC and
Okay.
see if they can answer them.
You can refer them on to me. I answered those questions repeatedly yesterday, both to the press and to the family.
Well, but they continue to generate it to
Then ship it on over.
a health
Take
and
care
human
of it for you.
services.
And lastly, again, I just want to reiterate again that the 100-plus employees at Dallas County Health and Human Services who have spent time away from their family, from their other activities, while other people are doing other things and checking with us, our staff, all 100 of them or more, are on the ground. So I would think it'd be distasteful for one section. It's everyone at Dallas County Health and Human Services, CDC, the state, the city, everybody is on the same page. But I'm going to give the top doc credit because he was the only one who went out and examined Miss Louise as the top doc in Dallas County. So I want to commend him for his leadership. Also, again, the daily activities involved in that, our staff were going out every day and addressing and responding just like everyone else. So I would hope that would be considered as we move forward.
Thank you.
Throughout the hard work.
And I totally agree, and had the occasion to join you on some Saturdays and Sundays, visiting as well with them, these families, and so I appreciate all that you guys have done.
I was last night with Marisa Gonzalez, congregation meeting, and I think as we spread the message of caution but knowledge, she was fantastic as well. So thank you, Mr. Thompson, for the great job.
Yeah, our health educators have been at every location where it's time to respond to getting messages out to apartment complexes day in and day out. And so I sent you an email where they were thanking Marissa Gonzalez for coming out. So our health educators have been on the ground every day in those locations, have not missed a step.
And thank you for getting the information out so that as we go out too and talk to people and people ask us questions, that we have accurate, current information to be able to provide them to counteract some of the other stories that are out there.
We'll ask
Definitely
Dr.
appreciate
Perkins, one last thing, I will ask Dr. Perkins, as we're involved in this on a day-to-day activity and we're focused on the Ebola situation, is that he will need to get with one of his staff to make sure we got some coverage on these other issues that we're facing on public health. That's why I'm going to need the CDC to send us additional people down to help with the monitoring. And so I'm going to ask Dr. Perkins as the health director, medical director, authority to make sure that we have some other coverages. Even though we're dealing with Ebola, they're still enterovirus, we're in the flu season, and so I want to make sure that he's satisfied with the coverage. So that's his call, not anyone else's.
Few things I want to add to that. Everyone is working extremely hard, and everyone is deserving of credit at Dallas County, at all of the departments, Sheriff's Department, Health and Human Services, our administration. Everyone's working extremely hard. There's going to be an opportunity to recognize the great work of employees, and I know that people feel a lot better now that these community contacts have rolled off the list, 51 as of last night. But we are still in a serious situation. I'll be leaving here in a few moments to meet with the governor. It's a much better situation. I believe we're winning the fight against Ebola now. I believe the likelihood of more cases is now at the other end of the bell curve. We're on the downward slope, with it getting less likely each day that we'll see more cases. The question that Zach touched upon regarding the elections, I want to make this very clear. I sent this letter to Tony Pippin's pool today, and this is based on the science. Eric Duncan was patient zero. That means that's where this disease came in our community came from. His community contacts are cleared as definitively Ebola-free by the CDC, and DSHS as of yesterday, as of Monday. His healthcare contacts are in isolation and won't go to a polling place until they are declared Ebola-free by the CDC and DSHS. Special dispensations will be made by the governor for them to be able to vote where they are. A contact is a person who interfaced with a symptomatic Ebola victim. A contact is not necessarily a carrier. Carriers become symptomatic 2 to 21 days after exposure. Until they're symptomatic, they cannot transmit the virus. The polls are safe and secure from Ebola. Poll workers should not worry about getting Ebola from handing someone a ballot. People should not worry about getting Ebola from going to a public place, whether it be a poll, a grocery store, a church, or a football game. If you didn't contact the bodily fluids of Eric Duncan, you weren't on a plane with Amber Vinson, you cannot get Ebola. And if you're on that plane and you're not one of the people that we're doing twice-day monitoring on, you cannot get Ebola. All right, so don't be afraid to go to your jobs as poll volunteers. Don't be afraid to go vote. Do your civic duty.
Two further points. I see Dr. Carlos here, and I'd like to say to the court something. I'll follow up with him, and I've already conversed with Dr. Perkins. We would like Dr. Carlo, Dr. Perkins, and Hospital Council to kind of coordinate our next steps in terms of ensuring that what happened in Dallas County and Dallas, Texas won't happen again. So I'd like to at least start preliminary with our health authority, working with those two groups to look at next steps. The last piece in this, because I don't want anybody ever be accusing me of saying anything about the CDC, but I will say this. Funding for public health and public health hospitals has to be a priority. That's a congressional decision. So right now, Texas stands to lose funding in local health preparedness dollars as well as hospital readiness. And so this is not the time to reduce funding for the state of Texas. This is an example of the Ebola crisis that we've been talking about for years, of how prepared we should be, or how prepared that hospitals and local health departments throughout the nation have to prepare for this type of situation. It's been clearly demonstrated that there is more work to be done. And the only way this work is going to be done is with the federal dollars coming into Texas, coming into Dallas County. And so I would say, and if you hear me say it, that's what I'm going to say, is that increased funding for local health departments throughout the nation, specifically Dallas County, as well as hospital readiness, has to be a priority of the Congress. So that's not talking about the CDC, that's talking about Congress has to make sure those dollars are allocated. So I hope our Dallas delegation will see what happened here and make sure that there is adequate funding for continued preparedness in the local and hospital readiness.
Funding and the legislative changes that you mentioned. I remember when we have other incidents like Katrina, we have some legislation that was called post-Katrina. We never, realized that we have some outdated legislative laws when it came to first responders and the knowledge that they have to have. I'm very pleased that my colleagues in the Commissioner's Court, supported that. But I agree with you on the briefing. That has to be addressed. Thank you.
Well, you have to be real careful, because what Congress does and what they did during those, quote, declared disasters, they created thresholds. And in Texas, if you remember Katrina, Gustav, Ike, all of that, before we can even make a submission, we had to meet a $35 million threshold for a declaration. That's one of the issues we ran up against the other day. So in the meantime, what happens is local, we pick up the tab. And you're exactly correct. But we've got to be real careful watching with that threshold, because that $35 million disaster threshold.
The threshold needs to go, but here's the deal. As we're going in uncharted territory, the fact that we're seeing interim revisions or interim documents being developed shows that all public health is local. So I put my money on our top doc, working with Dr. Carlo and the hospital council to look at ensuring what is needed here as opposed to a top-down. This should be coming
Bottom up.
bottom up. Bottom up.
I totally.
Now, we'll be in the same situation. We got chikungunya. That legislation I'm talking about is just not Ebola. I'm asking on chikungunya, we'll run into the same scenario, and so we might as well get ready today.
I'm going to ask that we move along, just because I've got a meeting with the governor, and I want to be here for a couple other things.
Got a briefing session, Judge. Item 1 on the budget. Recommends Commissioners call authorize the Sheriff's Office DDA initiative to hold one photographic services manager position for the first 6 months of fiscal year 2015 for a contribution of $28,000. Item 2, authorize the Sheriff's Warrant Division request to enter into a 36-month agreement with subscription service for CLEAR for the purpose of using search services. Engineering and Project Management. Number 3, authorize the issue of Architecture Engineering IDIQ work order number 22 in the amount of $13,000 from Moody Nolan VAI for professional services. Governmental Affairs, adopt the attached 84th Session Dallas County Legislative Priorities document as an outline that will guide the governmental affairs effort of the county during the upcoming legislative session. I do want to add Chapter 81.046 of the Health and Safety Code that Director Thompson, I think there should be support for that.
And I want to see Medicaid expansion on our legislative agenda. The most important thing we can do for our citizens is get 133,000 of them that are currently going to Parkland, and our taxpayers are paying for the sort of health coverage that they need. The Citizens Council, the Dallas Regional Chamber, and several other groups are making this their top priority for us, so we need to be in line and make it our priority as well.
So we'll add those two pieces.
Well, I want to see, before we add it to our legislative, I want to see their sign on. I hear that. I want to see them. I want to, you're the bringing resolution, something. I'd like to see a sign on.
And I'd like to see the court vote on that.
Okay.
Sure. Yeah, but I want to see a sign on.
We're off the ring, let that go for it.
No, they have mentioned it publicly already. I hear that, and I agree. We should sit here and just show support from, the court with other organizations that have a big say in Dallas County. Also, I just wanted to add the CJAP legislative agenda will be coming out pretty soon. It's going to be very short. Mr. Martin, we're finalizing it. You should have it. I talked to Mr. Reed as well, so thank you.
Thank you. Human Resources, item 5, recommends Commissioners Court approve the continuation of the DART annual pass program and an upfront cost of about $275,000 that will be reimbursed by employees. Information Technology, number 6, approve the personal services contract for the period of November 1, 2014 through October 31st, 2015 for mainframe support in the data center. Juvenile, number 7, approve the fiscal year 2014 training opportunities with mental health services grant. Public Works, number 8, accept the offer from RC Hope Group, LLC, to purchase tax foreclosed property at 8303 West Wisdom Road in Dallas. Item 9, consent to sell a property at 501 Rosewood Hill Drive in Garland, Texas. And item number 10, consent to sell a property at 151 Lake Drive in Garland. Mr. Brown has a number of bring-ups.
The first bring-up, I'd like to notify you that we'll have a court order on next week for a permanent easement with Encore for the panoramic circle. We've finalized that and need the county judge's signature. Second item is to purchase 4 thermometers, infrared thermometers for the Sheriff's Office central intake for a total cost of $572.20. And to buy, it's going to be 2 boxes of barrier masks for a total of $163.90 for the screening of inmates at central intake.
I just wanted to say a special thank you for number 3 also, so that RNB1 is on its road to becoming the new RNB1.
Yes. Judge, that concludes your briefing agenda. You have one speaker listed today.
I have a question, I'm sorry. There was a personnel item addendum. We received a request that if that matter was going to be discussed, that it would, the employee requested that it be discussed in open court. And so, having gone through the agenda, I'm not clear as to whether or not that discussion is going to take place in open court or has been pulled for discussion to a later date, as had been requested by the employee.
It's a matter for executive session, and we'll deal with it.
The
Well, the
employee
employee-
requested that
Right.
the exception for executive session on personnel is limited to the employee asserting that privilege, and the employee has waived that privilege. Or is what?
Where is the assertion of the waiving?
I believe she's put it in writing to someone.
The employee put in writing the request that the matter be heard in open court to me. I forwarded the communication to Mr. Martin as court administrator yesterday. It was my understanding that he had advised the court.
So would you like to do that in open session, or would you like to wait?
Does it say it's waived?
She requested to be in the concession.
And here's you're not supposed to give these out? What is this for?
No, sir. The only thing, my concern is merely that I received a request from an employee for an open hearing per the statute. If we are going to proceed in open court, the employee who had asked that this matter be postponed till the employee could be present, asked that that statement that I've provided to you be a part of the open record. So the issue is, are you going to proceed with the matter today in open court? If you are...
If we're not, am I supposed
That's
to...
nothing, but what is the email that was sent out to us? That's the statement that was
I haven't
sent
seen
out.
any of that because I've been kind of busy, but...
Correct.
I'm supposed to give it, is it the employee's wish that whatever's in this folder be shared with all of us or not shared with us?
It is the employee's
Not clear
wish that
what
it
you're
be
asking.
shared if the discussion is going to be
Okay.
had today in open court.
Is
It is the
discussion gonna be
employee's
had in
wish
open
that
court?
the discussion be postponed until the employee can be present.
Well, then we postpone it until she can be present, or the employee can be present.
Is that the will of the court? Is there, I'm fine for that. Do we have 3 votes for postponing it until the employee can be?
She's not quarantined, but she's
under court, she's under agreement.
She's under guidance.
So she's not able to come to court, and we
I
shouldn't
will-
discuss it until she's able to come to court.
I will move that we postpone this until.
Well, you can't
Motion
move it.
second.
You can't move it.
Yeah, you just don't bring it up.
You can't move it.
She's requested it.
So are we in agreement that matter is postponed?
Yes.
All right, I am not going to stay for the executive session. It is a violation of the Open Meetings Act. I just warn everybody ahead of time, if you discuss that in the closed session, given that, assuming that, Darrell, you do have some email from her?
I sent an email out yesterday to the court members.
Please be mindful of that. I do apologize, I have to go, and Commissioner Price is in charge.
We have one speaker.
That's the case.
One speaker,
I'm in charge.
correct.
I'll reverse whatever you said. Anyway, go ahead on.
Yeah, one speaker, Mr.
We
Chair.
won't allow her. You can move to your...
So we just have the one speaker?
Have the one speaker.
You want to read it?
All Commissioner Court attendees are hereby advised that this meeting is conducted in accordance with the provisions of Dallas County Code Section 74-71. Visitors and registered speakers are to preserve order and decorum at all times. Personal, profane, or slanderous remarks are not appropriate and will not be allowed at any time during this public meeting. Any and all pauses to be kept brief in observance to time constraints. Disruptive visitors and/or registered speakers may be removed and are subject to penalties provided in the state of Texas Penal Code Sections 38.13, 42.01, and 42.05. Registered individual speakers are limited to a maximum of 3 minutes and a maximum discussion on any one topic to 30 minutes.
Apparently there's one speaker, Mr. Araj Farisad. Mr. Araj Farisad. Mr. Araj Farisad, not hearing anything from Mr. Farisad. That concludes our speaker agenda. We will now retire into executive session for all of those matters that are permitted by law under Section 551 or 7 of the Texas Government Code.
Tracy, you got these.
heard from executive session. No decisions having been made into that executive session. We're now adjourned. Okay? Thank you.